care, and above all, the commitment to providing quality health care are the building blocks for the long-standing nurse anesthetist program at Mount Marty College. A thriving program, 75 years in the making, it was the vision of the Benedictine Sisters of the Sacred Heart Monastery in Yankton that initially answered a call in 1905 to provide a nurses training program at Sacred Heart Hospital.
Nurse anesthetists were really the first anesthesia providers because surgeons, when anesthesia first came into being, surgeons wanted nurses because they felt like they could control them, and that if they had doctors, they'd be paying more attention to what's going on over the drape than the patient getting anesthesia.
As the hospital expanded, the need for a clinical facility for an anesthesia program in South Dakota became apparent, and it was nurses who were looked upon to tackle the difficult task.
Sister Donata in 1926 became a nurse anesthetist, and I don't know if she was the first one in South Dakota or not, but I probably think she was the first formally trained nurse anesthetist.
Sister Donata Bentel was a registered nurse living in Minneapolis, Minnesota. She attended a 3-month course at St. Mary's Hospital before spearheading a program at Mount Marty College. Initially a diploma program, it consisted of 8 months on-the-job training at Sacred Heart Hospital.
When the program started in Sister Donata's first classes, they shared information that they got from their training, and that was all just notebooks.
Soon, the nurse anesthetist program at Mount Marty College received full accreditation and welcomed its first graduates upon successful completion of a certification exam. During this time, a young Sister Arthur Schramm became a member of the Sacred Heart Monastery, and in 1952 enrolled in the nursing program at Mount Marty College. She often found herself in classes filled with fellow nuns or single women because of the need to live on site and be ready for round-the-clock calls.
I was in nursing, and they needed the lay woman that was her instructor was going to get married, and they needed a second nurse in anesthesia. So we had about 5 sisters that were now CRNAs, or Certified Registered Nurse Anesthetists. But as they went down the line, they came to the end of the totem pole, which was me, because none of the other ones wanted to teach anesthesia.
In her own words, divine providence was already preparing her. In the following years, Sister Arthur taught anesthesia and had a long-range plan to further develop the program. In 1965, she became the new program director and received approval to pilot a bachelor's level program.
Well, I always say we stand on the shoulders of giants, right? We've got people like Sister Mary Arthur, Sister Virgil, who really had a vision for nurse anesthesia education for the state of South Dakota, and really took that task on and worked with students in hospital-based settings, and then moved it into Mount Marty College. And we were the first program in the country to offer a bachelor's degree for nurse anesthesia education.
When it came to techniques, we had no monitors other than our 5 senses, and I say my 6th common sense. We just had to observe every minute.
You talk to some of the more seasoned CRNAs who've been around for a long time, long before every operating room had EKGs available to them, before oxygen saturation probes were available to them, and their assessment skills must have been amazing, because you didn't have those numbers to look at. You had to look at the color of the blood and keep your hand on the patient's pulse constantly to make sure that you were getting the patient through safely. But nonetheless, even without all those monitoring devices, nurse anesthesia has a long history of safe practice.
In 1970, Mount Marty employed Sister Harriet Goebel to develop several new programs. One of these would be the long-awaited bachelor's level program in nurse anesthesia. The newly expanded curriculum included both college core classes and nurse anesthesia courses in an integrated clinical format that spanned a 24-month period. The number of students enrolled increased greatly during this time, proving the advanced educational opportunities to be a positive move for both students and the community.
We never had a problem getting students. But the advantage was they were highly motivated to go through that process. And so when they went out better anesthetists than I even had anticipated.
The success of the program led to the need to further expand. By the early 80s, a master's program was in place. Over the next 25 years, the nurse anesthesia program at Mount Marty College would undergo countless expansions, transitions, and changes. All were welcomed by the community and led to greater opportunities for students seeking to learn the trade.
The schooling is very, very challenging, but when you're done, you are trained to be what we kind of generally call just a general practitioner. You should have a base level of knowledge to be able to go into any sort of case, in any sort of situation, whether it be an ambulatory surgery center, a big teaching hospital, or a small critical access hospital. You have that training to be able to function in those environments and confidently function in those environments.
Sister Arthur Schramm retired in August 1993 after launching policies for outreach and extended campus programs at surrounding clinical sites. This would eventually include both Sioux Valley and McKinnon hospitals in Sioux Falls, South Dakota. Students had successfully petitioned for an evening program to obtain a master's degree. Because of this flexibility, students were given the opportunity to further their education and could continue to do so at Mount Marty College.
I would say Mount Marty students are very independent practitioners by the time they get out of this program because we have so many clinical sites for them to get experiences at.
Over the last decade, additional clinical sites were added in South Dakota, North Dakota, Nebraska, Iowa, and Idaho. Countless students have gone through the nurse anesthesia program, making Mount Marty an educational pillar for quality healthcare education. And in 2015, Mount Marty obtained approval to transition to a Doctor of Nurse Anesthesia program, and students officially began programming in May 2017. This recent advancement has led to greater opportunities for students, better care for the community, and much earned prestige for the college.
When you go to have surgery in a hospital in Sioux Falls, I don't have any hard numbers, but I'd say 90, maybe 90+% of the CRNAs practicing in Sioux Falls are Mount Marty graduates.
From the early times of rubber tubes, glass bottles, and ether, to modern-day simulation labs where students practice real-life situations, Mount Marty is proud to carry on the tradition of providing local, quality education that is easily accessible and embraces future opportunities to continue the legacy.